through advocacy, education, and outreach to promote and support breastfeeding. I want to just, one of the, I don't have an MA. I was going to say, I want to look at my initials a little here. I do come from a business background. My master's is in business. So I'm always looking at things in terms of cost benefit, and we will be, I'll be addressing that in just a little bit. I'm also a registered dietitian, and my interest in infant nutrition first came about from the nutrition point of view. I became a Lamaze certified childbirth educator and a board certified lactation consultant just in the last 15 years because in Lamaze we talk about normal birth, and in breastfeeding we know that normal birth begets normal breastfeeding. So it's all about connecting these things. So I'm grateful to be asked to be here today and help make that connection even more firmly between normal birth and breastfeeding. So what's the big deal about breastfeeding? Everybody knows that it's best, yes, but the data clearly show that in developed countries, breastfeeding, exclusive and extensive breastfeeding, reduces the risk for many childhood outcomes. The ones on the left are acute, so we get acute otitis media, dermatitis, GI nonspecific, which is diarrhea, and asthma. Those are all, before asthma. Those first three are all things that happen for babies in the first 6 months to a year. So breastfeeding, we've known for a long time, has impacted these things, but we thought for a long time that was only in developing nations where they don't have clean water and good nutrition, but no. These data are from the, These data are from the ARC report published in 2007 on developing nations only. It was a meta-analysis of 40,000 studies. The other items here, asthma, type 2 diabetes, leukemia, SIDS, and obesity, are long-term outcomes. And just as one of the previous speakers showed that babies who are born early or take trips to the NICU or whose mothers have had cesarean surgery or even induction have long-term outcomes also. You saw asthma on that slide as well. So something happens when babies come on their own time and in a normal birth and have normal breastfeeding that impacts the immune system of children. And because all of these asthma through SIDS are totally immune issues. Now, the reason we circled obesity here is because today in the United States we have an obesity epidemic. And just as the Congresswoman said earlier, we have Department of Health and Human Services support. Secretary Sebelius let us know that there is effort going into maternity care. There is also effort from her department going into breastfeeding, and it is through the pipeline of obesity prevention. So chronic disease prevention is part of the Affordable Health Care Act. Today, obesity prevention is kind of the flavor of the month. And I tell you this because it's important that we know what are the drivers, what are the political drivers, so that we can get on that train. The train that breastfeeding is on right now is the obesity prevention train, so let's take advantage of it, would be the message there. A little bit more about obesity on the next slide. Specifically, exclusive breastfeeding for 3 to 6 months is associated with reduced risk of childhood overweight, and the risk of obesity, which is a higher BMI, goes down 4% for every month of exclusive breastfeeding. So it's not breastfeeding once, it's breastfeeding exclusively for the first 6 months and for the first year with solid foods being introduced. So we get more, it's dose related. Breastfeeding is dose related. Next slide. Breastfeeding is not just about improving healthcare outcomes for babies, but also for mothers. And these three are very strongly supported in the research: breast cancer, ovarian cancer, and diabetes. There are other maternal risk factors, maternal issues, illnesses that are impacted, but the evidence isn't quite so strong. So this was published in 2007. I know in another 5 years when it's updated, we're going to see more things on the slide. But I also want to point out here, diabetes is on this slide. When we become pregnant, our risk for diabetes goes up, and it stays with us for the rest of our life. But the good news, that's the bad news. The good news is when we breastfeed, the risk for diabetes goes down not only to 0 as if we hadn't been breastfeeding, but even below that. So the risk for diabetes for women is tied to this issue of obesity in our country, and it's important to tie the breastfeeding behavior for both mothers and babies to those issues so that we get the support we need from the policymakers. Next slide. So what's going on? We saw a lot of great data about birth practices comparing to other norms. Let's take a look at what's happening with breastfeeding, and the most recent data we have is from 2010. Our best hospital in LA County has 79% exclusive breastfeeding. That means that while the mother and baby are in the hospital, just that 24, 48, 72 hours, that they are exclusively breastfeeding. And 9 out of 10 moms choose to breastfeed. So in that best hospital, almost everybody who chooses to breastfeed is able to be supported to exclusively breastfeed. We never want to see that, we always expect there will be some difference between her intent and her ability overall, because there's going to be some mothers and babies that have medical indication for formula supplementation. So 79% is pretty darn good. Not as good as some of the hospitals in Northern California, but that's a different story. The state average, though, is only at 57%. We birth about a third of the births in our state in LA County, and because our county average is only at 39%, we're bringing the state down. And we have many hospitals who have less than 2% exclusive breastfeeding in LA County. What's going on there? Every mother and baby are separated, and every baby gets a bottle, except for the little guy that was born on Friday night at about 11 p.m. and escaped sometime on Saturday and missed the nursery trip and missed the bottle. That's why we have 2%. But basically, it's hospital practices. It's hospital practices that drive the breastfeeding rate. And to have this big disparity within our own county is a shame, which is part of what we're saying this morning. But I do have some good news a little later. Another shameful thing, go ahead, next slide, is that we have racial ethnic disparities that are unacceptable in my mind. To have the gap be so much larger between any breastfeeding in the hospital and exclusive breastfeeding for our Hispanics and our African Americans and our Pacific Islanders, but yet a much smaller gap for our Caucasian mothers is a shame. Shouldn't be that way. But the good news, next slide, is that we do have national leadership. In the White House, the West Wing, the president had a white paper prepared and presented on obesity prevention and included breastfeeding strategies in it. In the East Wing, Michelle Obama has the Let's Move campaign, which includes breastfeeding strategies as well. A little bit was mentioned, Nisette said, in the Affordable Health Care Act, that insurance companies have guidance on breastfeeding services. It is a preventive measure. Preventive measures that are rated high are those that are covered, now mandated, for insurance companies as well as Medi-Cal and Medicaid. So, breastfeeding services, the services of a lactation consultant and breastfeeding supplies, mostly pumps, are now part of our national legislation. It's our job in hospitals and in clinics and in the community to figure out how to get the insurance companies to actually do what they are mandated by law to do, and that is pay for the services. But at least we have national leadership. The Surgeon General issued the very first ever call to action on breastfeeding a year ago right now. The Healthy People 2020 targets include 5 breastfeeding targets. And the Centers for Disease Control have funded projects that include breastfeeding strategies. Here in Los Angeles County, the Community Putting Prevention to Work grant will conclude in March of 2012, in other words, next month. It has been a 2-year project that has been funded for the county, Department of Public Health, to do obesity prevention work, policy work, and the breastfeeding strategies included increasing the number of employers with worksite lactation accommodation and having our 3 county hospitals become designated as baby-friendly. Olive View Medical Center achieved that designation last June, and Harbor UCLA and LAC had their surveys last week. Everybody, cross your fingers for them. We're in the period of waiting. We have up to 8 weeks to wait to hear if they've received that designation. And the Joint Commission Perinatal Care Core Measures, our 5 core measures, include inductions and cesareans that have already been discussed, but also include breast milk feeding. Next slide. It's also now in California the law.